How's it going? We have Mr. Garcia here, my patient. We're going to be doing a Foley catheter on him. So before we even do that, we got to do the essentials, the essentials as it always is. Wash our hands and also do the double check on him, see if the procedure is right. So once we do the double check, we can advance with our procedure. So we have here our Foley catheter kit, and we're going to remove the inside, which has our kit. I already kind of removed it beforehand because it wouldn't come out. So we're going to remove the kit like so. Place the bag on the side. So what we're going to do here is something very special. Something very special to line your nose. So we're going to be pinching the sides because the sterile field would be within the 1 inch outside mark. So here we're going to carefully pinch so we don't break any sterile technique, like so. Keep pinching. So here in the last part, we're not going to want to touch our box. So just push down and grab it and put it to the side. So here, just move around so you don't break any sterile technique and you're not going over anything. So like so. Okay, now that we have all this set up and open, we were going to want to get our gloves. So here, without breaking sterile technique, what you want to do is put this up and grab it like so and put it to the side. And then here you're going to open it up. So here you're going to try to be careful to not break any sterile technique. So you're going to grab the flaps. And again, just the outer 1 inch portion. So now you're going to want to do is grab your gloves. So grab your left glove. So the sleeve, outer sleeve is sterile. No, it's not sterile, sorry. So you can grab it with your hand and then put it in to your hand like so. Maybe my thumb will go in. You can mess this up. You can come back later and fix it. So now, what you're going to want to do, see, this keeps coming because the wind here is hard. So this is not sterile, but just pretend it's sterile. So what you're going to do now is grab your other glove from the inside, because your hands are considered sterile. So the inside is, the hands are considered sterile. So grab the inside of your glove to keep sterile technique. So put your glove like so. So now that you have...
I can't, I'm sorry.
So now that you have both hands sterile, you can come back and fix this glove since this is sterile. Like so, just fix it. Just fix it like so. Okay. So now we move on to the box. So what you're gonna want to do is fix your box so it does not look like this, since there's no room to move it. So move it just to the side like this, and then what you want to do is move the top box outward. And here's the drape that you're going to use. This is called a drape. So you're going to grab your drape. Here, you don't want to break sterile technique either. So what you're going to do is grab your hand and put your fingers like so without it touching your other body parts. But since the wind is strong right now, it's not letting me. So here, to keep it away from your body, I just broke sterile technique there because I touched my hand, but it was just because of the wind. So place it underneath your patient. Here you can tell your patient to lift a little bit. So Dr. Garcia will put the drape under you. So since this is not a real patient, it's kind of hard to not break sterile technique, but we did what we could. So now that you have your drape underneath your patient, you can set up your other your other materials. See, this is just breaking sterile technique because the wind is just so strong. But if the wind wasn't this strong, it would be chilling. So here, what you want to do is get this. You're gonna need this, so you can throw that away. Get your swabs. I think you only need one set of swabs because it's pretty clean down there. Just set up your swabs like so. Also, you're going to want to remove the covering from your catheter. Be careful with this as it could break sterile technique. Just remove it slowly. Like so. Then you could throw this away. Just be careful where this falls under. Like I just broke sterile technique there by it touching. So just be careful where it dangles. So now what you want to do is set up your lubricant. Open this up. And then once you open it up, you want to squeeze it here and then throw it away. So once you squeeze it there, you're going to get your catheter, the tip of your catheter, and lube it up. Once you have it lubed it up, put it back into the box. Be careful with it though, as you don't want to break sterile technique. Place it back into the box. Then you want to get your little pump here. Take the cap off. And then you want to place it into the little tube here, like so. Just squeeze it in there. Make sure it's hold on tight. So now that we have our thing set up, what we're gonna want to do is get the little swabs here, and what you're gonna do is go from the urethra outward in a circular motion. Do not go outward inward because that will break sterile technique. So now this will be considered my unsterile hand. So now I'm gonna grab the penis. So now I'm grabbing the penis here. So now I'm gonna go from the urethra, go outward. So this is trash now. Grab the other one, go from the urethra, outward, like so. Trash. And then again, the third one from the urethra, outward. And throw that away. So now what we want to do is grab a catheter. So this is considered sterile. What we are going to want to do is put it in to the patient, like so. Keep putting it in until a little bit urine comes out. Once a little urine comes out, just move it a little bit, 1 to 2 centimeters in. Once that happens, now you can grab onto this. Make sure you pump the whole 10 cc's of the liquid inside to the catheter. So just push it in. That's going to be a little bit difficult, but that's okay. The balloon's inflating. And once the balloon inflates, take this out without any liquid going back into the pump. And then what you're going to do is take this out, tape it to the patient with a special adhesive tape, and then put this underneath the bladder and hang it, if there's a bed, hang it to the rails. After that's done, then to take it out, what you're going to do is first deflate the balloon with this. And once the balloon is deflated, ask the patient to take a deep breath and then remove it. And that is it.